Did you know your eyes could be sending you a secret warning about your heart? It's true. And today, we're talking about a very specific sign, one that almost always appears in just one eye, and it's linked to high cholesterol. Stick around, because understanding this could be a game changer for your health. So, what is this mysterious sign? It's called a xanthelasma. That's Xanthelasma. It sounds complicated, but it's actually quite simple to spot. A xanthelasma is a yellowish, soft, slightly raised bump that typically forms on or near your eyelids. You might see it on the upper or lower eyelid, often close to the inner corner of your eye, near your nose. Now, the really peculiar thing about it is that while it can appear on both eyes, it very frequently shows up on just one. You might be thinking, what causes this weird yellow spot? Well, these bumps are actually small deposits of cholesterol that have collected under your skin. Think of it like a tiny pocket of fat. While they're not harmful or painful in themselves, they won't affect your vision. They are a powerful visual clue. They're like a little yellow flag waving at you saying, hey, you might want to check your cholesterol levels. Now, why is this so important? Because high cholesterol is a silent condition. You usually don't feel it. There are often no obvious symptoms until it leads to more serious problems like heart disease, heart attack, or stroke. High cholesterol means you have too much of a fatty substance called LDL or bad cholesterol in your blood. This can cause plaque to build up in your arteries, making them narrow and stiff, a condition known as atherosclerosis. This process is like a slow-moving traffic jam inside your blood vessels, and eventually, it can cause a complete blockage. This is where our little yellow friend, the xanthelasma, comes in. It's one of the few visible external signs that your internal cholesterol levels might be out of whack. Studies have shown that a significant percentage of people with xanthelasma, some research suggests around half, have high cholesterol or other lipid disorders. So, seeing one of these on your eyelid is a strong prompt to visit your doctor. It's crucial to understand that a xanthelasma isn't a disease itself, but a symptom of an underlying issue. It's a cosmetic concern for some, but its real value is as a diagnostic clue. Your doctor can perform a simple blood test, called a lipid panel, to check your cholesterol levels. This test measures your total cholesterol, your LDL, the bad stuff, your HDL, the good stuff, and your triglycerides. It's quick, easy, and gives you a clear picture of what's happening inside your body. So, what happens if you get diagnosed with high cholesterol? Don't panic. This is actually good news because now you can take action. High cholesterol is highly manageable. Your doctor will likely recommend lifestyle changes as the first line of defense. This is where you have the power to make a huge difference. Let's talk about diet. It's all about making smart swaps. Instead of foods high in saturated and trans fats, like processed snacks, fried foods, and fatty meats, you'll want to focus on heart-healthy options. Think more fruits, vegetables, and whole grains. Soluble fiber is your best friend here. It's found in foods like oats, apples, beans, and Brussels sprouts. It actually helps to trap cholesterol in your digestive system and remove it from your body. Healthy fats are also key. Avocados, nuts, seeds, and olive oil are fantastic choices. And don't forget fatty fish like salmon and mackerel, which are rich in omega-3 fatty acids that are great for your heart. Next up is exercise. Getting regular physical activity is one of the most effective ways to manage cholesterol. It can help raise your HDL, the good cholesterol, which acts like a cleanup crew, carrying bad cholesterol away from your arteries and back to the liver to be processed. You don't need to become a marathon runner overnight. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be a brisk walk, a bike ride, swimming, or even dancing in your living room. The key is consistency. Find something you enjoy so it doesn't feel like a chore. Managing your weight is also important. Losing even a small amount of weight if you're overweight can have a significant positive impact on your cholesterol levels. Often, Combining a healthier diet with regular exercise naturally leads to weight management. In some cases, lifestyle changes alone might not be enough to get your cholesterol into a healthy range. Your doctor might then prescribe medication, such as statins. These medications are very effective at lowering LDL cholesterol and have been proven to reduce the risk of heart attack and stroke. It is essential to take any prescribed medication exactly as your doctor instructs and to continue with your healthy lifestyle habits. The two work together as a powerful team. Now, let's circle back to the xanthelasma itself. What if you have one and you want it removed for cosmetic reasons? There are several options available, such as surgical excision, laser treatment, or chemical peels. However, it's vital to remember that removing the bump doesn't fix the underlying problem. If you don't address the high cholesterol that caused it, the xanthelasma can and often will come back. That's why treating the root cause, the high cholesterol, is always the most important step. So the key takeaway today is this: your body has fascinating ways of sending you signals. A small yellowish bump on your eyelid might seem insignificant, but it could be an early warning system for a much more serious condition. Don't ignore it. Take a moment to look in the mirror. If you see something that looks like a xanthelasma, don't self-diagnose or worry. Instead, see it as an opportunity. Make an appointment with your doctor or a qualified healthcare professional. Let them know what you've seen and ask for a simple blood test to check your cholesterol. Knowledge is power, especially when it comes to your health. By catching high cholesterol early, you can make proactive changes to protect your heart and live a longer, healthier life. It's all about listening to your body and taking those small signs seriously. Thank you so much for watching today. I hope you found this information helpful and empowering. If you did, please give this video a thumbs up and consider subscribing to the channel for more health insights that can help you live your best life. And as always, take care of yourself, and we'll see you in the next video.